Hello, my name is Kelly Palmer. I am a registered nurse and a trainer with Neonatal Rescue. In this video, we will cover the clinical use of the NeoLife ventilator for heated high-flow nasal cannula. High-flow nasal cannula may be indicated for neonates with respiratory distress syndrome, mild respiratory distress syndrome, retractions, or tachypnea. Babies experiencing consistent apneic episodes lasting longer than 10 seconds may also benefit from the use of high-flow nasal cannula. This therapy may also be used for babies with bradycardia, mild hypoxemia, or to help transition following extubation. High-flow nasal cannula helps the neonates by reducing the work of breathing and improving oxygenation. Potential adverse effects include airway dryness, increased pulmonary pressures, and nasal trauma. When using high-flow nasal cannula in neonates, current studies recommend initially setting the flow at 2 liters per kilogram per minute. The table included on this slide may be used as reference when determining the initial liter flow. It is suggested to use an FiO2 of less than 40% to achieve the desired FiO2. The oxygen blending table provided with the NeoLife ventilator may be used as reference. Set the heater temperature between 34 and 37 degrees Celsius. Use the non-invasive setting on the heater when available. For more information about how to decide when high-flow nasal cannula is appropriate for your patient, please see the references provided in this module. A baby who is on high-flow nasal cannula may require a higher liter flow if they have a respiratory rate between 60 and 80, are experiencing mild retractions, or have consistent oxygen saturations below 88%. The FiO2 may also be increased in increments to improve the neonate's oxygen saturations. The healthcare provider should consider transitioning the baby to CPAP or higher levels of care if the baby's respiratory distress score is at 3 or above. Other indications that the baby is requiring greater levels of support include a respiratory rate consistently above 80 breaths per minute, grunting, moderate or severe retractions, and nasal flaring. If the baby has been stable on the high-flow nasal cannula for at least 12 hours, the healthcare professional may begin considering weaning. First, assess the baby for retractions, grunting, nasal flaring, apnea, and bradycardia. If any of these are persistent, consider increasing respiratory support. If the baby is not experiencing these signs of respiratory distress, check to see if the FiO2 is below 30%. If the FiO2 is not below 30%, you may begin weaning if in increments of 1 to 2% as the baby tolerates it. If the FiO2 is below 30%, check the documentation to see if the flow has been weaned in the last 12 hours. If the flow has been weaned within the time period, maintain the current flow while weaning the FiO2 as tolerated. If the flow has not been weaned in the last 12 hours, you may begin weaning the flow by 0.5 to 1.0 liters per minute. The flow may be weaned every 12 to 24 hours as tolerated. Once the flow is weaned to 2 liters per minute and the baby is stable, the provider may consider discontinuing therapy. This concludes the information on the clinical application of NeoLife High Flow. Please contact us with questions via our email, training@neonatalrescue.org. Thank you for watching.